When you train your pelvic floor, having some basic knowledge of the anatomy and how it functions can really help with a deeper connection and understanding what the exercises are doing and how to tap into the pelvic floor. Here's a model of a woman's pelvic floor. We're going to go ahead and show you the bottom side. The pelvic floor acts like a hammock inside our body and holds our pelvic organs inside. If we didn't have our pelvic floor, they would fall out between our legs. You can see the attachment at the pubic bone and the tailbone and how the striations are front to back. Same with sits bone to sits bone, and it's lateral. It's also fan-shaped, which allows for a passage of a baby to be able to stretch and rebound back. The pelvic floor is 3 layers, and as you can see on the inside, it is similar striations as well. When we breathe, if you're a shallow breather, the pelvic floor will tend to be tighter, and if you use diaphragmatic breathing, the pelvic floor is going to descend and ascend in your body, just like your diaphragm does. And the pelvic floor is a base of your core, and the diaphragm is the top of your core. So the pelvic floor health is really essential for proper core function. I don't recommend tightening the pelvic floor when you're training the pelvic floor. You want to keep it relaxed. I also don't recommend Kegel exercises. They're concentric contractions, which will tighten the pelvic floor. And a hypertonic tight pelvic floor is not a good thing. You can go ahead and go to our website for more information on that and different articles to understand why, if you want to explore that. You want to stay relaxed when you train the pelvic floor. Really picture the concentric and eccentric contractions of the pelvic floor, that lengthening and rebounding that the pelvic floor does. And the more you train the pelvic floor, the stronger it's going to become, but it's also going to become toned, elastic, and flexible, which is really an optimized pelvic floor for a woman.